Thank you so much for joining us today. Here we have everyone, if you're not familiar, we have Elena Gardella and Francesca. What's your surname? Sorry, I forgot.
Furia.
Oh, okay, fabulous. And well, we've been working together for a while now, Elena, which is lovely. And I'm going to be able to meet you again and you soon, Francesca, at the SCN8A and SCN2A conference and family gathering. That's right, isn't it?
Yeah, exactly.
I believe, what city are you in again right now? Milan, yeah?
Yeah, we are now in Milan, but the conference will be in Køge, which is a city in the seaside in Denmark. Yeah.
Okay, lovely. And how far away is it from Copenhagen?
It's about 40 kilometers. It's
okay.
easy to reach.
Okay, cool. Could you tell everybody a bit about yourselves quickly, just so anybody who doesn't really know you yet knows a bit about what you each do?
Yes, with a pleasure. So I'm a neurologist and I'm from Italy, but I'm based in Denmark now. I've been working all my life, my career. I mean, I've been working in epilepsy. I'm deeply interested in epilepsy, in the epilepsy field, and mainly in the clinics of epilepsy and in the phenotypic, and try to merge the discovery that we are now working with the basic scientists to import the discovery into the clinics and try to make something which is, in any case, can improve, I mean, the treatment and the counseling that we can give to the patient. And now the Danish Epilepsy Center, where I'm working together with Rika Müller and with Francesca, which is our PhD. So we are working on the deep phenotyping on genetic epilepsy, monogenic epilepsy. And my favorite monogenic epilepsy are sodium channelopathies and especially SCN8A. And we worked there's a joint venture between SCN8A and 2A because they are so similar and so much at the same time different, so much to new to discover it. So we try to help each other in improving and speed up, the knowledge in this field. And this is why we came to this meeting. But probably I just introduce myself. So
yeah, okay, that's great. And Francesca, tell us about yourself.
Yes, I'm a medical doctor, a neurologist, also from Italy, but now based in Denmark. And I've always worked also in the field of epilepsy, which is my main interest. Now I'm a PhD student at the Danish Epilepsy Center, and I'm working on genetic epilepsies. Really a very interesting work. And my main project is about SCN8A in my PhD.
So what is it that makes you both favor the SCN8A gene?
Probably my enthusiasm is contagious. So Francesca is getting started.
It is contagious.
No, at the very beginning, it was somehow by chance, like the best story starts. It started because we met with research wasn't one of the many research that we were carrying on, and then at the same time we had some very interesting cases which were difficult to merge because they were so different. So, and it was difficult counseling patients because they are different trajectories. So I felt at the very beginning it was really needed to understand more and to work more and to help these children in a different, personalized ways. And it was at the beginning of very close to the discovery of the gene actually in human beings. So actually it was because nobody knew exactly what it was. We had the chance to have a group of patients to talk with, and this is so important to work with patients and families because it's really crucial to improve our understanding and to move steps together forward. And we start collecting other experience for colleagues, and so we have now a large register of more than 700 cases, and at this time we are able really to understand more or less the puzzle I was made by, and then step by step it become our big big love, because
like your baby project to take care of and develop.
at the very end is so much, I mean, of yourself and what you do, also in personal relationship among others. So, I mean,
motivate one another, and yes. And yeah, I've often said in recordings that what keeps me going, or almost keeps me going during hard times, is knowing that there are people like you guys doing what you do and giving people hope for the future and collating all this information, because you know, you have to embrace one's inner geek when it comes to these things, you know, the science and the mathematics behind it and the technology you all use. And so what is going to make this conference, which is next week, I can't believe it's come so quickly, in Denmark, what's going to make this different from other conferences that may say they're competitors? I don't know.
Yeah. No, actually, we think that somehow is similar to other gathering meeting with family. But the crucial point, this is now we are really building a network between, I mean, basic scientists, physicians, and families, especially here in Europe, which actually was quite, I mean, it's not very organized also because of the barriers, you know, the language, the different speech. So it's not like in the USA where the different states can connect to each other in an easier way. So we have been working for the last, I mean, at least 7, 8 years together with the families. I've seen, I mean, the birth of the first family association. I have personal relationship with the families that you are also talk with, you get an interview, and so it's something, I mean, that now, and we were used at the Danish Epilepsy Center as a culture in Denmark to have meeting for family, for spread our knowledge to family, and our dream was to have a big one for our SCN2A. We did the first one in Bonn 2 years ago, because together with Valid Fazeli, because that time there was the chance to host a Radical Day there, and it was great. But we still we had the dream to host it in Denmark, and now the second one has to be in Denmark. So I mean, now we have in a time in our in the progression of this story where I think. We are ready for doing something big, really, because family are organized pretty nicely. Now there is the first European network. We know each other, and we will like to include as many people as possible, and just be, I mean, a huge organizing work. Francesca did also a great work. We also had to thank Laila, our secretary. We have been working hardly for getting this meeting here in person. Now we are so excited that it's going to happen, and so happy that you will be there, Tori, because it will be fantastic having you there. And
yeah, it's going to be fun, I think, because people, understandably, epilepsies are, and comorbidities, all that comes with them, especially with the rarer genetic epilepsies, they're pretty flipping awful. But what I find with events like this and being around you guys, it really kind of helps lift us up a bit and encourages one another. It's, it's not a party as such, but it's realizing that, families that come to this, and indeed clinicians, and we, realize that, oh my goodness, we're working together. We're not alone. We're all after the same thing. We all want to improve the lives of these children and some adults sometimes. And so I think it's a sort of really positive experience. We've even got, I know of one mum, Chris Pierce, she's flying all the way from Australia to come and actually meet us face to face, which is amazing. But what percentage would you say is our attendees, clinicians versus clinicians and patients versus, oh my God, I can't talk, sorry, clinicians and researchers versus patients' families?
Yeah, the first day is more a scientific one, so dedicated to basic scientists and clinicians. And we made the program, we split the program in 2 days, splitting the topic. The first day for clinicians, but family are attending, and they are coming with children as well, which is extremely interesting, with the sick children, which we know, and we do not know, but we're happy to host in any case. And the second day is made of a kind of translation of the most important topic to have a more family-friendly language. spreading in more details the information to them, and so some topics which are dedicated to the families. And Francesca has been, working.
Yes, I managed especially the registration for the families and the communication with them for the accommodations. And I think the most interesting thing is exactly this. So to have the possibility to communicate directly with the families and know them, their story, to have the possibility to hear from them their experience. And so we can mix our forces together, clinicians and families. I think it's the most important aspect. And I like very much to have this relationship, very strict, with families and with patients, to have the possibility to meet them there and talk with them, because I think it gives us much more.
What does it give you? Doing this rather than the old-fashioned way where we were all separated, things are, communications are heaps better thanks to people like you. What does it bring you as a clinician and researcher?
Yes, it gives us, from a scientific point of view, much more information, because you can characterize the clinical aspects much better when you can hear them directly from the families. Because we can just speak a language that we can understand each other. So there are not misunderstandings, because we can explain what we are seeing each other. And so we can have a much more clear clinical overview. And it also, from a human point of view, it gives us much more, because there's not only the patient, but there's much more. There's the family, the quality of life, all these aspects that should also be considered.
That's so nice. And I suppose, does it help you to sometimes even rearrange your priorities of what you are studying or what you're focusing on? Like, what is the most important thing to the patient or the family? Because I guess sometimes that differs from what you might originally have thought. Is that true?
Yeah, definitely. But what Francesca said may sound obvious somehow, but it's really important also from another point of view, just to exactly build the bridge between the basic science, our clinical, my theoretical management of the disease, and the real life. And this is, it's difficult to explain if you do not try. But every single patient is peculiar, and sometimes, but you have sometimes stereotypical, image of the patient, which you need to treat that. It's so important to be able to modulate and apply the single, new insight that we get from the basic science and from our clinics to that, needing. Which is do not come up from the spreadsheet that we collect. This does not come up from the all the chart that we collect. It is something else. And this helps us really much. Now we are working with subgroup of patients. We are not working with a single, SCN8A disease. We are working as a subgroup. We are tailoring all our research and all our insight in more definite. And this was possible just because of this interaction. So I think it's somehow obvious what we said, but as an enormous, impact on our, research and also, management activity or daily life.
Yes, I think it's really very important to have this bridge, because it helps both us as clinicians to understand much more, and also families, because they are connected with us. They have a referment.
This is like a model for genetic disease. Somehow it is true for anyone.
I completely agree. And I was having a chat with a mum recently, Para, who and we were talking about how we say rare epilepsies, or we'll say epilepsies in general, and people, even clinicians, just think about seizures, but sometimes the most important thing might be their lack of cognitive function, or their sleeping activities, or some movement disorder, which all comes together. But unless we are all able to communicate. It's sometimes, I think, hard for you guys to realize that, isn't it? And that's why this type of event is crucial.
Yeah, absolutely.
Yes,
absolutely.
Cool.
You got a point. Yeah.
Well, I think I kind of just repeated what you said, but anyway. So if anybody would like to come, they can either be clinician researcher, they can be family, they can be anybody who's interested, right? And in genetics or quality of life, we're not turning anybody away, right?
No. Anybody's welcome to come. I mean, it's very important to make this meeting in person. So we'll welcome anybody to come, and also we try to squeeze up, even if you do not have place enough, please send an email to us and we find a place. And otherwise we record also the talk. So if anybody really is not, do not have the chance to reach out to us or to join us, we also have recordings, and Francesca will write a kind of summary of the whole topic for families. So there will be the possibility to get up something from that anyway.
Brilliant.
But right.
All right, well, we'll provide links to that and everything after the event, but I do hope we can see as many people in person as possible. I do realise that sometimes it's hard for families. Know of a family, Gabby, where she can't leave her child, so she can't come in person. So there are some times when that happens, right? So it's great that you're recording it. Brilliant. And if anybody wants to get in touch with you, as spoken of, how should they do that?
There are two. I mean, the family association, the SCN8A has a homepage where you can find our.
I'll put the link below. That's cool. Yeah.
Or you can just write to me and Francesca. You can find us Elena Gardella Francesca Furia at the Danish Epilepsy Center. Google or.
Okay.
Yeah.
I'll put the link in. Yeah. All right. Well, fabulous. Thank you so much for your time. It's been wonderful seeing you. And again, I can't wait until next week. It's going to be fabulous. And see you then. Thank you.
Yeah. Thank you.
Thank you so much, Tori. Thank you.